Y'all, I'm back. I'm back. I know it's been a minute. I'm so trying to get consistent, and I think I finally figured out how I can do that. So I'm gonna tell you all about it in a minute. But what's up, Level Up Medical Coding family? You know, it's me, your girl, Kat, and I am really um, fascinated by this video topic because it seems to have been like a theme in for my entire career. And I'm talking about the age-old question: will AI replace medical coders and billers? And so we're going to talk all about it. But first, let me just put a disclaimer out here. This is my very first video using my AI twin. I know y'all been seeing it all over social media about AI twins. And I think this is going to be the thing that helped me out in my business to be more consistent with posting YouTube videos, with making all these courses that I just have in my head and my heart. And, helping those of you that are on the same or similar, career path as I am. And just me pouring back into all the knowledge that I have, just getting it out without being overwhelmed. As you know, like I am already juggling so much, not only with, family and career wise, but I am trying to, be a resource in putting this out on social media. And, sometimes this takes a back burner when everything else is weighing me down. But I think I finally figured out how I can be more consistent. And it's just making life so much simpler. So I love this topic of, is AI going to replace medical coders? Because I'm coming from it from a perspective as a person that always tries to stay up to date, especially with technology. And I'm loving AI, and I'm a coder and a biller. So I've been hearing this exact sentiment for the last 15 years, literally since I started studying for my CPC exam. Back then, people told me it was a waste of time because AI was going to take over all the jobs. Guess what? I'm still here. I can remember me asking one of my good friends to join me in this journey. I was just telling her all about it. We were so tired of working like call centers and whatnot. And her response to me was, girl, AI is going to take over those jobs eventually. I'm not about to invest my money into something that I'm not going to have a job in the next 10 to 15 years for. I'm looking for something that I can retire from. So I said, okay, well, I didn't see it that way, but she saw that. And that was, I guess, one of the biggest decision makings in her not doing medical coding. So I just share that story because I've been hearing this for over 15 years, literally, like that AI is going to eliminate these jobs. But I'm gonna be honest with you. When I first learned about AI and the potential that it had, I was nervous. And you know what? I feel that's natural. When you don't know enough about something, or when something is new and you're learning about something and you're seeing, like it being used in certain ways, you get fearful. And fear fills in the blanks of what you don't know. And I'm the type of person that, unfortunately, I always think the worst. And so I got a little bit nervous. You start creating your own worst case scenarios when you don't have all the answers. But I've learned this: fear usually comes from not having all the facts. And the fact is that AI has been on the way for a long time. But as of right now, coding is still here. And it's because of the complexities that coding and billing just inherently have. Let me take you back 8 years when I first started working. I got my very first medical coding job, and we were working out of billing EHR software called Cerner. And within Cerner, we had licensed a software that was called CAC, or Computer Assisted Coding. And it was essentially AI. So what CAC would do would, when we open an encounter, it would scan the encounter, the document note, and it would try to pick out correct diagnosis or procedures that was documented in that particular encounter note. Sounds good, right? Like it just scan a note, spit out your diagnosis, spit out your procedures, and you good. But it wasn't that simple. So CAT missed context. Like it doesn't know how to read if the provider was ruling out a certain diagnosis. Like for instance, if the provider wrote ruling out a diagnosis of diabetes or ruling out diabetes, the CAT software would pick up diabetes and code that as if it was a current case. Or it could have been a history of cancer or breast cancer or something, and it would pick up breast cancer as a current diagnosis. And the same for procedures. Like it doesn't have all the nuances and the details for the different ways procedures are being done. And so it would either miss those procedures or code the wrong one. But for me as a new coder, like I found it valuable because I was already nervous about the job, and I didn't have to train I yet. I was developing my eye. So I could have missed a bunch of things in these notes. And it gave me at least a starting point, to look at the note, and I learned patterns that way and that way. And then I became more familiar with codes and how to capture things. But I can imagine for experienced coders that it was probably a nuisance. In fact, like all of our experienced coders used to talk about how much it slowed them down, how, it just would pick the wrong things. It created extra work for them, and they just did not like it. But looking back, I realized that those experienced coders was actually training the AI system. And so that was my first glimpse in, it needs the data. And if you have been in the world of medical coding and billing for longer than 6 months, you know that it's not as simple as picking codes from a book and matching them up with the documentation that the provider gives. There's a lot of nuances and complexities that come along on both sides of this part of the revenue cycle that AI just, like I said, it missed context. It doesn't know how to rationalize yet. And not saying that it won't get that capability, but because this is an evolving world, it always is going to need somebody to feed it data. All right, but understand me when I tell you this. Like, as much as I think AI is not going to completely eliminate us, the truth is AI is going to take some jobs. It's going to change the landscape of how we work. And that's how I choose to think of it. The truth is, AI will be more trusted and more accurate at doing some repetitive tasks. I'm not sure what that looks like yet, but here's my thoughts. It could be something as simple as taking on the task of modifiers or screenings, or you know, making checking the compliance and payer rules and things like that. I know that is being done sometimes, but not all practices have AI that can do all this stuff. So our scrubbers are great and our clearinghouses are great, but there is some things that, as we know, get through those things, and maybe we can use AI as another layer of defense. Can it code complex procedures? Can it code trauma cases or unique occurrences like anomalies? Like, I work in a pediatric clinic and we have all types of congenital malformations. And it's like, do you understand the intricacies and the complexities that comes with some of those surgeries? That's where I don't think the AI would be able to keep up with. That literally will take a human mind, because you need to be able to put a bunch of pieces together in order to be an accurate coder. And that's just one example that I have. The human body is just too nuanced. You have so many payer policies. Payer policies are too layered, and coding guidelines are consistently updated, not only yearly, but sometimes quarterly and sometimes every couple months. So, yeah, while AI is going to be good for allowing us to apply some of these things to our coding and billing processes and procedures, will it be able to take over the jobs that we do? Not completely. I don't think so. But like I said, repetitive tasks, simple tasks, of course. But again, I think this is where we have an opportunity to adjust our role and evolve with the world of medical coding and billing. I've always said that I feel like all medical coders are going to become auditors at some point. And when I say auditors, I don't mean like in a traditional sense where you have your auditing department. I mean doing the work of what an auditor would do once they are like checking providers' work. So a lot of the times you will probably either have the EHR or the AI system code what they think the medical record will look like or should be coded as. And you, as a coder, will come with your skill set, your expertise, and the education that you've been keeping up with, and make sure that medical record is accurate. A lot of coders is doing that now. The only difference is you don't have like an AI software if you are, you know, not advanced and buying into AI. Some practices are, but the majority is not buying into AI just yet. They're learning about it. And so you have the doctor or the provider code the encounter, and you have the coder basically audit the encounter and push it out the door. So what I think will happen before too long is that you'll have AI to do all the coding, and then you just need the coder there as a last step to make sure everything is cool, because the AI still needs training. And so for new coders, I think this is going to be a good thing. For me, when I had CAC, that was a blessing. I think that this will help new coders to narrow down their search, because as we know, when we are studying for this, like, it's an overwhelming amount of information. And it's not the most effective way to retain information is by cramming so much information in and then, you know, not having at least a guide to, you know, the real world. So this will help narrow down like your coding ranges when you are auditing the record. And maybe you can have the AI give a rationale for the codes and explain it to the coder and let the coder see if they agree with what AI picked out for them. And AI can explain some medical terminology that may not be, you know, familiar or may be hard for a coder or a biller to retain. I see AI as being a companion to coders, if more than anything, for the next, I don't know, foreseeable future. It will help you to like speed up your learning curve, and how much, you know, confidence you build as a coder if you have something like AI helping to narrow down your code selection and explaining, you know, what's going on in the procedure, because we're not clinicians and sometimes we need help visualizing what's being done so that we can be a more effective coder to make sure that we are working in conjunction with the provider and picking the right code. And now we'll be working with the provider and the AI software to pick the right code. But here's the flip side to that: it could make you lazy, especially if you just feel like the job is just easy peasy. You want to trust the AI, or your mindset is the AI should know it all, so I'm just not doing nothing. But it's not, at this point, AI isn't there yet, and it's not meant for a coder to be lazy, but it's a helpmate. So the flip side is, if you having those days that you just don't feel like working and you just want to push encounters out without double checking them, or if you just, I don't know, burnt out or not interested in the job, and you just, you know, let the encounters go out, you relying on AI too much, and it could not be trained properly, which could cause problems. But for experienced coders, I think that you will have an opportunity to evolve with this technology if you don't fear AI. You are the ones that's teaching it. You have an opportunity to become an expert. And my channel is all about leveling up your career. And this is definitely a huge way to level up your career. I think that every builder, new and old, should learn what AI software is available in our space and how we can learn something in it for the future, even though we may not be at that point yet. The AI is being used, at least if you're keeping up with the trend when it becomes a thing and is introduced in your job, you have that to put on your resume and you will stand above, the rest. Or if you are settled at your career, your forever career, at least you can evolve with the revenue cycle department. That's how you make yourself an asset to an employer and get to these six figures that we always talk about on this channel. So let's talk a little bit about what it's doing right now in billing that I have experienced, and I'm sure it's a lot of other things that it's doing. But my company hasn't utilized AI in coding at our healthcare system, so I can't speak to what is actually being done in coding for AI that I'm aware of. But on my business, my billing business side, I can attest to how AI is helping someone like me, a small business owner, with some of my billing tasks. So I've seen software out there that will help do verification of benefits, even though I am not trusting AI to do my verification of benefits for my clients. There is software out there that, will allow you to trigger stuff for verification of benefits. So I thought that was pretty dope. What I would love for AI to do is to, be able to review denial reasons and give us a layman's term, step by step process on how we should attack this denial, approach this denial, and even if it can pull some of the data from like maybe our EHR and put it together, put the appeal together for us. That would be really dope if it could do that. But I know it's not there yet. I would love for it to be able to correct simple rejections, like misspelling demographics, something before it, when it hits the scrubber say it doesn't like. And if it did the verification of benefits with the AI, it already has the way the insurance, has the first and last name on the insurance information or have the member ID. Maybe I'm one number off on the member ID and the clearinghouse rejects it. It should come back into the system and be, corrected and sent right back out the door without me even having to touch something so simple as that. As a matter of fact, it shouldn't even have that rejection because if we do the verification of benefits, we can have the software fix any, clerical errors before we go out the door. And one last thing I was thinking about I would love for AI to do is to automate patient requests, simple requests. Like if a patient emails or calls in or texts in and they want an itemized statement or they need like a copy of, their medical note that was put in their chart or they need a copy of their, of an encounter of a medical note or whatever. I would love for them to be able to go through the proper protocol electronically, HIPAA compliant, fill out the forms and the EHR just automatically send them that itemized statement or the data service that they're requesting medical records for or a copy of whatever it is that they want, something simple like that. So I'm, hoping that AI, will be a helpmate in billing. But I have seen that there are softwares out there that can do the verification of benefits and do other like tasks for small billers, small business people, like answer phone calls, do emails, things that ChatGPT can do. Okay, now we human, and let's keep it real. Like we have no choice but to think about the risk and just like what could happen if we allow AI into this ecosystem, especially dealing with PHI and sensitive information and all the things. Now, if we do lean too hard in on AI, like we will run the risk of unintentionally like being fraudulent, have some abuse going on. I could see it being, without checks and balances of having a fully AI EHR or revenue cycle. It's just too much risk there. You still need that oversight, and we all know what this means in the revenue cycle. AI doesn't have judgment. It doesn't stop and think. Does this make sense to go out? Are we overbilling, overcoding? Is the quantity right on this? Should it be this number or should it be, or is that the right, number for this drug? Like right now it doesn't have like, the rationale to know that. And so it still needs to be trained. And that's something simple. Those are some simple examples, but um, there's still a lot of areas that we need critical thinking in billing and in coding. So I definitely don't think that the future is AI or humans. I completely wholeheartedly believe that medical coding and billing is going to be involving AI, but it's going to need to have a human element through it all. Here's the thing I want you all to take away from this video. Essentially, we control the narrative. We are the ones that's developing AI, and if we don't want AI to completely take over our jobs, we won't create a program that would completely take over our jobs. And again, the human body is too complex and too nuanced, and medical technology is just advancing all the time. And so it's always going to be needing some kind of data training for AI to keep up with it all. AI isn't never going to end medical coding, but this is a huge opportunity for you to level up your skills. If you're brand new and you're worried about AI, please don't let it fear you. Start learning about it so you can get confident in it, and then decide if this is a path or career strategy you want to take for yourself. Make sure you learn coding in and out, medical coding in and out, and become an expert in whatever specialties of coding you desire. Learn a bit of AI and learn how to intertwine it when it comes time to do so into your career. Then figure out how to use AI as part of your strategy if you want to involve with the industry. I'm just going to leave you with that. So if you are studying for your medical coding exam, don't forget I have a medical coding study webinar that I think will really help you if you feel like I break down this industry in a simple way that you understand and you resonate with, and you're studying for your medical coding course. Check out my webinar. It's located in my stand store. I'll put the link in the description for you, and I hope that you find it resourceful and helpful in your passing your medical coding exam. And for those of you that is thinking about starting your own medical billing business, I'm trying to see how much interest I have in something like that. I'm starting to brainstorm, some kind of resource for you guys to help you start your own medical billing business. So if you're interested in that, join my email list. I'm also going to put the link in the description for you guys so that you can get updated whenever I do complete the resource, and just pop your questions in too. That'll help me come up with resources that's catered to your needs and your unique situation. And as always, if you have any thoughts, questions, comments, leave them below and let's get the conversation going. Here at LevelUP Medical Coding, we are not scared of change. We are utilizing every advantage that we have to level up in our career. It's all about using change to your advantage. So I'm going to leave you with this question though. How do you plan on using AI as part of your career strategy? How do you think AI is going to look in your role? What can it do to help you, to enhance? What would you wish if you had your master wish list of having AI do something that just, that it could help you with in your current role? What would that be? Drop your thoughts in the comments. I want to hear your vision. And as always, if you found this video helpful, entertaining, informative, whatever the case may be, give me a like so that I get that feedback, and I appreciate you for taking the time to do that. If you think that this video is helpful, find you a medical coding or billing buddy and share this with them and let them know that we're talking about some good stuff over here. And if you have watched to the end and you are not subscribed to my channel, what are you waiting for? Like, you literally just listened to me talk about medical coding for this entire video. So I kept your attention. Did I earn your subscribe? If so, go ahead and subscribe to the channel. And as always, keep leveling up. I'll see y'all in the next video.